You'll probably get your ballot in the mail in the next few days. Probably already have your voter's pamphlet. And so we have 3 of the interesting things that are on the ballot this year. We're going to start with Dan Mahr, who's the campaign manager for the Portland Children's Levy. The levy began in 2002. It was renewed in 2008, and now it's up for its 2nd renewal. And if you're wondering why there's only one side for the Children's Levy, as well as for the Metro bond measure, which will be next, there's no organized opposition to either of these. So we just have people telling us what it's about and handouts. And Dan, thanks so much.
Yeah, thank you. Thanks for having us in today. This is it's a situation I'm comfortable with. As the campaign season goes through, we're doing a lot of public speaking, and I always feel like I'm like the undercard fighter, like for the heavyweight main event of fluoride coming later, or the opening band for the headliner. And so a few things about the Children's Levy. It's been around since 2002, but it's a local property tax levy. So by Oregon state law, it has to be renewed every 5 years, so it sunsets. And that's why we're facing voters again now for the 3rd time. And so the levy, the basic idea behind the levy back in 2002 was to put some resources behind the rhetoric of making kids a higher priority in Portland. A lot of politicians like to talk about that. Often doesn't come with resources behind it. And so the levy was created to do just that, and it's a property tax, like I said. Moderately, it's a fairly small tax levy. It's about 40 cents per $1,000 of assessed property value annually. So if a house is worth $200,000, that's $80 a year that homeowner is paying into the levy. And so the levy funds programs in 4 specific areas that help kids within the city of Portland. The first area is early childhood education, things like preschool and Head Start. If you ask an elementary school teacher if there's a difference between a kid who's been to some kind of preschool and not, they'll almost assuredly tell you yes. Kids not only come into kindergarten already with a head start on things like counting and their ABCs, they've also been through a structured environment already, which leads to fewer classroom disruptions. Second area of focus is designed to keep kids in school and keep them engaged. And so I'm talking about like after-school and mentoring programs. Some of these names are familiar, things like Big Brothers, Big Sisters, Boys and Girls Clubs, that give kids constructive things to do in the hours after school and in the summer. And if I remember from my own childhood, after school is when I would get into trouble. So give kids something productive to do after school, keeps them out of trouble, and keeps them engaged in learning. The third area of focus, and I think the most heartbreaking, is child abuse prevention and intervention. On the prevention side, programs work with families who are at risk to provide things like parenting education. A lot of parents who have children young don't always have those skill sets built up, and so levy programs have opportunities for parents to come in and learn how to have a better relationship with their child, how to deal with an unruly child, things like that. Other programs provide things like respite care. If a family undergoes a stress like a relationship change or financial hardship, the programs will provide temporary care for children to kind of take them out of the home, let the parents get things at home sorted out before the kid coming back in. Unfortunately, all the prevention in the world doesn't always stop child abuse. So when that does happen, there are also programs designed to deal with not only the physical side of child abuse, right, treating a kid who's been injured, but also dealing with the mental and the emotional side of things as those kids begin the healing process. And a great example of this is called CARES Northwest, and they're over at Legacy Emmanuel across the river. And I went in and met with the medical director of CARES, and she took me on a walk around the place. And the idea of it is so kids who've suffered trauma have a place to come. They don't have to go in through an emergency room, but instead they're seeing physicians who are specialized to work with kids who've been through trauma. There are also mental health professionals that are on staff and that can work with the kids on that day, and then in the months following that as the kids come in for checkups. The fourth area of focus right now is foster care programs. This was added after the 2008 renewal. Levy staff was finding that a lot of the kids coming through, especially the after-school and mentoring programs, were foster kids, kids who are going through a lot of transitions, needed something stable in their lives. And so the levy added foster care as a focus to provide things like mentoring opportunities, but also working with foster families. One foster mom told me the other day, she's like, I'm a foster mom, but I'm also a foster mentor, a foster tutor, a foster therapist, and a foster ATM. And so being able to go somewhere and take my foster daughter, her foster daughter was in the process of applying for college. And so a mentor with an organization called SEI was helping this girl with her FAFSA applications and scholarship applications. So those are the four, I guess that's the foster care programs, and those are the four current areas of focus. Once we're renewed, hopefully we'll be renewed. In the following year, we hope to add a focus on child hunger. About 14,000 kids in Portland every month eat out of an emergency food box. And so a lot of kids get served meals at school. They get breakfast, they get a lunch, but dinner is often a bigger question mark. And so the levy hopes to work with organizations that are already engaged in the fight against hunger, and to narrow that down into child hunger and find ways to get healthy, nutritious meals into the hands of the kids that really need them. And that's kind of the generals behind the levy. It's very transparent and accountable. The money is allocated through a granting process. 5 people in the city of Portland make decisions. Those meetings are all held. They're all held publicly. The levy staff is small but mighty. They have about 4 people who work with the programs and make sure that the programs are reaching the outcomes that are intended. Everything, like I said, is very transparent. Annual reports are posted online so taxpayers and voters can make sure that their money is being spent wisely. And so when you get home tonight, you should see a ballot sitting in your mailbox. At least I hope you do. That's how the process is supposed to work. Did anybody get one of these in the mail?
I did. Thank you.
All right, got a few. Anyway, I have a one page that I can pass out once everything's done if folks want a little bit more information, and I think we've got a couple more minutes for questions.
I understand that when we pass these tax levies, like for the new library district that we passed last time, it compresses the budget that the city has available because there's a limit to how much
Right.
added on to property taxes. Can you kind of explain how this impacts
Yeah.
broader budget?
Sure. Oh, could you please? I repeat the question. Okay.
So
The question is basically, what is compression? So compression is, well, I'll start off by saying it was once said that there are roughly 5 people in Oregon who really understand compression, and I'm going to admit that I'm not one of them, but I'll do my best. So compression is what happens when basically, I guess I'll rewind. There are a few property tax measures that were passed in the 90s and then early 2000s that set limits on the amount of money that a property could be taxed. I believe it's a certain percentage that I don't have off the top of my head. And so let's say a property is already maxed out. They already have between a city general budget, a county general budget, a school bond, the children's levy, and let's say the library district. All those things are fighting for basically a certain set amount of tax dollars. And since that's capped at a certain percentage, that can only rise as the home value rises. So if home values are stagnant, that number stays the same. As more things are added onto the basically the property tax roster, it's the same pie. It just gets cut into more slices. There's also a difference between permanent taxing sources and local option levies. So the difference between the children's levy and say the library districts. The library districts, that was created to be a permanent taxing district, and so that doesn't have to be renewed every 5 years. And so that comes out of the same slice of the pie that the city gets their budget and the county gets their budget. The children's levy and the metro levy that you're about to hear about it comes from a kind of a different pool of money, and those are the temporary, the 5-year levies. And so Basically, the permanent taxes, they get their money first, and then the rest of us kind of get the other portion. And so when the library district became permanent, it then got put into that permanent pool and then was competing for money with the city. Whereas the children's levy doesn't really take away from the city's annual budget.
So there's one more way of looking at it. So the library district, whatever it said it was, if your property tax were already maxed out, they didn't actually go up by that much. They went up by a smaller percentage, since it was actually just reallocating money between different organizations, while this one will raise property taxes by the 40 cents per thousand, essentially no matter what, because there's no compression kicking in.
That's actually a good question. I'm not sure. If I can answer that correctly.
Okay. We do a lot of compression here in elemental.
I know that Dan you're staying for the hour.
I am, yeah.
So if there's more questions after, he'll be here to hang out. I just want to make sure.
Sure.
Thank you.
All right.
Properly done.
Cool. Thank you.
So next we have Bob Stacey, who's the Metro Councilor for District 6. And District 6 is in the heart central part of Metro. It goes from Gateway to Sylvan, from the Tigard city limits to Lentz, so probably covers a lot of us. It's the smallest geographically, but densest with population. So, and Bob is also a dedicated cyclist. He bicycled here and is going to talk about the Metro bond measure. Thanks Bob.
Can I hand these to you, Emily?
Sure.
And just distribute it around. There's a very colorful piece. Hi, Bob Stacey. Yes, on measure 26152, we have a power or a PDF here. I'm just looking on the wrong side of the screen.
Just use the arrows.
Use the arrows. Okay. This is not a Mac. Sorry. We'll get there.
That goes. You just
But this
can't
hasn't
see it.
launched yet.
Oh, it's
up
behind you.
Okay. You see that there? Terrific.
And then just go screen to
I'm
screen.
gonna. Good. Okay, so measure 26152. Did you see the nice splice screen at the beginning? Restore our natural areas. This is brought to you by Metro, your regional government. I serve on the council. This is that unique regional government that we have in the Portland metro area, the only one in the country. It does a lot of different things. It manages cutting-edge land use and transportation planning to make our future better than we have it today, if at all possible. It manages the zoo, the convention center, solid waste and recycling. And as it turns out, Metro owns and manages the largest amount of public parks and natural areas in the three-county Portland metro area. 16,000 acres. Now, that's like 3 forest parks combined, plus another 1,000 acres left over. So picture yourself in Forest Park, 23-mile-long Wildwood Trail. We've got the equivalent of 3 of those under management. But it's not all in one place. The Metro levy on the ballot, did I skip over one? Yes, I did. On the ballot on May 21st, would raise about $10 million a year at about 9.5 cents per $1,000 of value. On the typical, average, median house in the Portland metro area, that's $20 a year. And it operates for 5 years. You heard compression explained. We now have established, Dan, that there's almost 6 people who can explain compression. Ask me a question about it afterwards if you have continuing questions. But we have an effect, a small effect on the children's levy. The children's levy has a significant effect on us. But in most of the region, outside of properties in Portland and a few properties in other areas, compression doesn't affect the collection rate. If you're in compression, you wouldn't have the entire amount of this levy collected against the property you own. So what are we going to do with this? This is a map that shows some key project areas, very schematically, that would be restored or maintained by this measure. $10 million a year for 5 years to do about a dozen major restoration programs, to build trails, to restore eroded areas, to install natural features and natural channels in segments of streams that have been channelized in the past and rendered not very productive. It's fundamentally to take acreage that Metro's acquired in 2 voter-approved bonds. One back in 1995, one in 2006. Each of which the voters said, go forth and protect these lands before they're developed, before it's too late. These aren't clear out in the national forests. The farthest ones away are in the Sandy River Canyon, south of Troutdale, Oxbow Park and other lands, or Chehalem Ridge, south of Forest Grove and Hillsborough. The rest are in or very close to the metro area itself. Mount Talbot is in Clackamas, just south of the Portland city limits. The Cooper Mountain Nature Park is in suburban Washington County. Johnson Creek flows through southeast Portland and the Clackamas County exurbs. And Metro has contributed land to all those natural features to put them in public ownership. So, big deal, major opportunity to keep nature close at hand and accessible to people. Building trails to those parcels that don't have trails now, but people have cut their way in, undoing that damage. And that work will be divided essentially in 2 pieces. The major restoration piece for wildlife, for water quality, for fish, and other activities that get people into nature, whether that's the trails or it's volunteer efforts that get leveraged by nonprofits, because Metro will have a $750,000 grant program out of that $10 million a year that will go to Audubon, to Friends of Forest Park, to Friends of Terwilliger, to other organizations, Friends of Trees, that can turn folks out to leverage that money into even more activity and effort to restore these lands. So here's some lovely examples. I mentioned Chehalem Ridge. It's about 1,400 acres of cut-over timberland that was replanted in accordance with the Forest Practices Act, which means a lot of spindly dug firs. It'll be restored with a mix of conifers and other native species. It'll be provided with trails. Its quality as natural resource land will be improved, and we'll have access to it. Places like this, the Killen Wetlands. In the agriculture country of Washington County, this is an area that isn't farmed, can't be farmed, but is potentially enormously productive for wildlife and for water quality in the Tualatin Basin, and needs to be maintained, needs to have invasive species taken out. Johnson Creek, I've already mentioned. Those of you who are familiar with it know that it was channelized by the Corps of Engineers and the Works Progress Administration in the Great Depression, so it ran like a flood stream in rainy weather, and then was in a channel the rest of the year. It's being restored to its natural condition through partnerships between Metro, the city of Portland, and others. Clear Creek is another example. Ugly, huh? Well, the point is, we've got 16,000 of these acres, some of which we inherited from Multnomah County before we got into the acquisition business ourselves, like Oxbow, which have enormous value for wildlife and water quality. And without this measure, they will continue to slowly suffer the fate that many of you have seen in Forest Park. It's a beautiful, beautiful piece of ground. Those trees are over 100 years old in most cases. And because it's in an urban area, invasive species, principally English ivy, have gone in and climbed toward the canopy, and in some cases threatened the lives of those trees. When we start killing trees in Forest Park because we can't maintain them, we know there's a problem. Portland has that problem. Metro shares it at Forest Park because Metro has acquired about 400 acres to add to Forest Park. And we don't want that problem to get out of hand any further on the 12,000 acres that Metro's acquired. When we got into this business and acquired parklands when Multnomah County went out of the parks business, we also acquired enough resources to manage those 4,000 acres. But Metro is a tax-limited government. It can't do new functions like take care of the other 12,000 at the same high level of quality without coming to the voters and asking your permission. So, 9.5 cents per $1,000, $20 on the average house. We have to come back to you in 5 years and ask your permission again, or come up with a better way of maintaining these lands in the long run. And we get to do some large-scale, major restoration efforts to protect them in this first 5-year go-around. Why does this matter? I think water quality for fish and people, clean streams, healthy habitat, and forest stands have inherent value in their own right. But a very wise guy, smart guy, named Sam Blackman said back in December in a piece he wrote in the Oregonian, part Portland's competitive edge in attracting smart people, he apparently was talking about you guys, is that we have access to nature that's unparalleled. We have the coast, we have Mount Hood, great skiing, great surfing. We also have a place we can get to on foot, on bicycle, in a short car ride to a place where the kids, adults can connect with real nature that's protected as real nature in the midst of the urban fabric. I think it's worth your attention. I hope it's worth your vote. I hope it's worth a check. And I'll answer any questions you got. Thanks.
We have time for, yeah.
How at risk are these spaces that you're describing, how at risk are they to be developed for housing, for sprawl?
The first agenda in the 95 measure. Oh, sorry. The question is, how at risk are these properties to development for subdivisions or other urban development? In 1995, with $130 million, Metro went out, $130 million the voters gave to the Metro Council, went out and acquired land with just that concern in mind. This is a growing region. It was growing very fast in the 1990s, and it was very feasible that many of those could have been lost to land development. And again, in 2006. So there was a Great Recession. We were able to buy more land than we expected to during the Great Recession, and we protected that much more from just that problem or concern. Now it's in public ownership, now it's protected, now we have to maintain it. Thanks very much for your time, and vote yes on 2652.
Thanks so much, Bob. So now the main event, as Dan referred to. And just a couple minutes before we started, we did a coin toss for who was going to go first. So we're going to have two 10-minute presentations. Yes, or excuse me, no, and then yes, on fluoridating the water. And then time for questions. So first, this is Kellie Barnes. Oh, excuse me, it's right here. And this is for, I'll grab you the mic. Kellie is the founder of...
Should plug in
the founder of Core Physical Therapy. She's practiced physical therapy for 20 years. She's got a BA in biology, a master's in physical therapy, and orthopedic manual therapy, and just recently completed clinical and written exams for her doctorate in orthopedic manual therapy. So her dissertation is underway, and you can hold too if it doesn't clip.
There we go.
Cool, thank you.
So this is Clean Water Portland.
Yeah, sorry guys, this is my turn. I have candles.
You can hold.
This one? Can you guys hear me with the mic? Close enough? Yeah, good. Well, thanks for having us. And as I was introduced, I am a physical therapist. I'm also a mother of 2 young children and a volunteer for Clean Water Portland. And I believe that we should not be adding fluoridation chemicals to our water, our clean water, for 3 primary reasons. I believe that clean water is essential for the health of our children and the health of our community. And I feel as a physical therapist looking at the literature that the emerging science shows there's a reasonable basis for concern. In addition, we have better alternatives. And as the SMILE 2012 survey that was recently released due to public request through the media, not by the state, shows we are truly doing pretty well already since 2007. Hey Beth, I have a favor. Come on up here and advance this for me if you don't mind. So as you can see, between 2007 and 2012, Multnomah County is down 10%. The state of Oregon is down 19%. And you'll hear, well, you know, is 51% really okay in decay rates? If you put this into a national perspective, the national average, according to the Department of Human Health Services, is 54%. The 2020 oral health goals of our nation are 49%. Can we do better? Absolutely. Do we want to prevent cavities? Yes, but we need to be talking about Portland statistics and putting it into a national perspective. Multnomah County on non-fluoridated water is already above the national average and has met our 2020 goals. In addition, if you look at K2, if you look at their link, and look at the average of non-fluoridated schools in Portland, you can see again that our decay rate is better than the fluoridated schools in our city. Granted, there's some differences in the averages, but overall, when you look at that picture, it bears the question, do we have better alternatives? And is there a reasonable basis of concern? And can we look at better options? It's really important to also realize, because you may have heard in the TV and the radio, and I'm sure you've heard it in your flyers and read about it, there's a lot of talk about untreated dental decay comparing Portland to Seattle. Let's be clear, and you can look at the underline here, according to the Oregon Health Authority. Untreated dental decay is about access. And I agree, kids in Washington have more access to dental care than kids in Oregon. We have 27% more of families below poverty line. We have lower median incomes here, according to census data, by $10,000 to $15,000. There are more low-income clinics in the state of Washington. So don't let that number be so misleading. It's all over the media. Untreated dental decay is about access. And if you look at Healthy Kid, Healthy Initiatives of Oregon, since 2009, we have enrolled 6% more of our children. Surely that's a reason that some of her numbers have improved here. So you'll hear that there's consensus. Every major medical group agrees that we should be using fluoridation chemicals in our clean water. I will say that's not true. The American Kidney Fund, American Kidney Association, American Cancer Association, American Diabetic Association, none of them endorse the policy. It's worth noting that according to the National Academy of Sciences review of fluoride in drinking water, that these are the very subpopulations of individuals at risk. In addition, there's not world consensus. Only 5 out of 48 Western countries fluoridate, and you'll hear it's due to salt and infrastructure and other things. It's due to freedom of choice and emerging science showing reasonable basis of concern. In addition, people like the NAACP local chapter have looked at this issue and have recently endorsed our campaign, Sierra Club and other organizations, Columbia River Keepers, etc. And while there are local organizations that have endorsed, none of them asked for an oppositional perspective prior to their endorsement. And I'll just mention also, historically, we've seen this before. Science changes before policy. Think about tobacco, lead, asbestos. It takes decades before policy and institutions change. There is not a consensus on this issue, even though others like to say there is. So what are we talking about? The Portland Water Bureau has been clear. What we're adding to our water is not a mineral, it's not a nutrient, it's not calcium fluoride, it's fluosilicic acid. And this is particularly important because it's not simply something that we're bringing up from the earth to some optimal concentration, which incidentally isn't dose. It's something that contains contaminants, and even according to NSF and the CDC owns website, you will see 43% of what samples we have show arsenic, 2% lead, copper, chromium, other heavy metals. You'll hear them say, no big deal, it's legal, some are undetectable. Doesn't mean they're not there, and it doesn't mean that the EPA public health goals on water for arsenic and lead, their tolerance is 0. The other thing that's interesting, this is such an acidic chemical, pH of about 1.2. They'll have to add more of a buffer into our water supply already. Do we add chloramines already? Yes. Do we add disinfectants to kill bugs? Yes. But should we knowingly add arsenic and lead to our water in the name of medicating our neighbors? I would argue as a mother and a healthcare provider, no. Go back for a sec, Beth. Another interesting thing is because we do use chloramines here in Portland, hydrofluoric acid has been shown to leach lead, not only from lead pipes, but brass alloys. Granted, this study was at 2 parts per million. They've never done one at 0.7 parts per million. I would love to see that. Multnomah County is already full of lead, and it's a definite known risk to our low-income children. You'll hear on the other side that the National Academy of Sciences study, no big deal, fluoride in drinking water, not about communal drinking water. The purpose of that study was looking at maximum levels through the EPA of naturally occurring fluoride. However, they looked at hundreds of studies on fluoride, some at very low levels, and what their report found is our kids are getting too much fluorosis already. We actually have 41% of our kids aged 12 to 15 with fluorosis. That's a visible sign of too much fluoride exposure. In the wake of this study, the U.S. Department of Human Health Services lowered maximum concentrations of fluoride allowed in water by 40%. The first change in decades after presumed safety. In addition, the ADA and CDC and others started issuing infant advisories. What that says, if you're using fluoridated water for your infant formula, your child's at risk for fluorosis. Many people say, but we should breastfeed. Yes, that is an optimal choice, but many low-income families cannot choose that, and many women of color do not breastfeed, according to data in our nation, 2 to 1 that of white women. We're not even talking about this issue as we vote on it. In addition, you'll hear that the chair of this committee, John Dole, no longer believes that this is an issue relevant for water fluoridation, this review, that he supports water fluoridation. This guy's been all over the map. You can read this quote here from Scientific America, and these other scientists that were on the panel, National Academy of Sciences Review, have endorsed our campaign. It's worth looking at the voters pamphlet because there's a very diverse perspective in there, and you'll see that there's not consensus that this is a safe and effective policy. So what the National Academy of Science Review found, we need more research. There's a reasonable basis for concern. We don't have a lot of data on the policy. What effectiveness data they claim isn't really enough to claim that it's working. And you'll find that they also found various subsets of populations at risk. People with diabetes, thyroid disease, infants, the elderly. These are very key targeted populations that we need more research on. Thyroid alone in the Portland area and those consuming our water, 40 to 50,000 people. What do we say to those people? Or people like Mike Lindbergh that you'll see in the voters pamphlet, prior city commissioner, who's been told by his MD and internist he cannot drink fluoridated water. And you can read about this in the guide. What do we tell those people? And that's due to arsenic levels in the water for that individual. The National Academy of Science Review found effects on the brain. I put the quotes there. This is available online. The immune system, risk of cancer, such as osteosarcoma, and the endocrine system. It's been said that it's an endocrine disruptor. We've got a lot of these already. So I'm not saying the science is conclusive. I am saying there's a reasonable basis for concern that our data is showing improved oral health here. And in city after city after city on fluoridated water for decades, the low-income children and the most vulnerable populations at risk, it's not being shown to be effective. It's not 25%, folks. It's not 1 out of 4 teeth. If you read the literature, it's about half a cavity. So they like to say we're cherry picking. They like to say this is junk science. These publications, performance, funded literature is not from junk science. These are some of our top institutions in our country. And if you look at some of the studies, like the Harvard dean now says, well, we still believe in water fluoridation. Well, they have economic interests and PR interests. But the scientist of that study feels it's relevant to Portland and there's a concern for our children. What about the effectiveness? CDC says the benefit's topical, not systemic like once believed. They like to say it's bathing our teeth, but the CDC studies show the concentration of 0.7 parts per million is not enough to have topical effect. In addition, if you look at World Health Organization data, you can see that their cavity rates, mostly on non-fluoridated water, are essentially equal to ours. And how much water and fluoride are we actually talking about? If you take one 12-ounce glass of 0.7 parts per million fluoridated water, compare it to a pea-sized bit of toothpaste on your kid's toothbrush at 1,000 parts per million, typical of toothpaste. That's equivalent. We've got the math on our website. Over a course of a day, you're swallowing about a strip of toothpaste. And as I mentioned, our kids are already getting too much fluoride. They'll say the white spots on the teeth are no big deal, they're simply cosmetic. But let's face it, that's a first sign of too much exposure. And on Q&A, we can talk about costs, if you guys like to go into that.
Kellie, thank you so much. As you guys can tell, this 10 minutes for each of them is shorter than usual, so thank you so much for getting through.
Got to make it reasonable.
And so next up is Mike Plunkett, DDS and MPH. Sure. He's the dental director for Care Oregon and the Neighborhood Health Center, an assistant professor at OHSU, and was appointed to Governor Kitzhaber's Oregon Public Health Advisory Board. We're timing him 10 minutes. Thank you, everyone. Thanks, Mike.
Hello. Can you hear me?
You're good.
Okay.
And your pointer
Yeah.
is
I like the
here.
pointer.
No, that's
Hello,
okay.
thanks for having me. Mike Plunkett, she said I'm a public health dentist. I see patients in a community health clinic where my patient population is limited to Oregon Health Plan, which is our public health insurance, and uninsured low-income families. I've done that my whole career, starting in Kansas City, a little bit in Little Rock, Arkansas, where I'm from. You might hear a little bit of the accent. And Portland is the first non-fluoridated city I've lived in my life. So what is Healthy Kids, Healthy Portland? We're effectively a grassroots organization, and I can tell you it's all local. Every single dollar we've raised, all the workforce, all the support we've got is local. Over 80 organizations, the ones you see along the bottom, Northwest Health Foundation, Coalition of Communities of Color, Urban League, Kaiser Permanente, Care Oregon, for which I work, NAIA Family Center, which supports Native American interests as an advocacy group, and 75 or more organizations support us and are working very hard on the weekends, on the week, calling, doing everything they can to inform voters about this. So we can do some basic comparisons. I'm not going to show a whole lot of really detailed scientific slides. I can definitely talk to you about that, but I want to keep it with context because I think that's where this conversation really needs to stay, because there is context, and going into these deep dives and very specifically selected studies is very troubling to me, and I'll tell you why shortly. So when you look at Portland versus a city like Seattle that's been fluoridated since 1970, anyone here in here from Seattle? No? Anyone thinking about moving to Seattle for your job? Because they've been fluoridating for 30 years. And they have decay rates about 40% less than Portland, and this is probably a little less now because of the numbers she showed, because we've had a little bit of improvement from 57% decay rate to 51% in the Portland area in the last 4 years. But it's still significant. It could be 33 to 34% higher decay rates in the Portland area. So that's about 21%. 1 in 5 kids effectively have untreated decay. This is what rampant decay looks like. This is not all kids. It's a very slim number. I saw a 22-month-old child on Wednesday who had 3 cavities. And people get really exercised and say, well, this is over-dramatizing. Look at this little girl. She's got healthy eyes, skin, hair. Her teeth are bombed out. She ended up at Dornbecker under general anesthesia. Care Oregon, in which I work, is an Oregon health plan, Medicaid health plan. 7% of our 0 to 5-year-old children had that kind of decay last year. It's not an isolated event. It's a lot of children. And general anesthesia, there's good science actually to support that there is a real danger to children for going under general anesthesia for something that's as preventable as tooth decay. So about 93% of seniors over the age of 65 have experienced decay. 18.2% have untreated decay. There are a lot of factors have to do with less access to insurance, less access to community preventative measures, especially if there's no fluoride in the water, and isolation. Manual dexterity with age decreases, especially if there's physiological disorders that cause nervous problems. And we have real consequences that'll never make it onto a scientific study, because dental, unlike medicine, is not practiced in large conglomerate groups where it's easier to isolate and look at numbers. A lot of dentists are small solo practitioners, and their quality assurance programs are just not that, they're not that public. So we don't really know sometimes what goes on out in the community until we open up the doors of a large place like the convention center for the Mission of Mercy, and 3,000 people stand in line, some of them camping overnight in the cold rain. It's a huge problem. It's a huge problem. I've been out through Central America, South Africa, done a lot of work around the world in developing countries, and I can tell you that what we see in a lot of the United States for low-income patients especially reminds me a lot of what I've seen in Nicaragua and the favelas of Brazil and in the townships of South Africa. It's a huge problem, and past Surgeon Generals have called it a silent epidemic. David Satcher, during the Clinton administration, called it a silent epidemic. And who really suffers most? The low-income kids. There are a lot of reasons for that, having to do with poor or inconsistent insurance, having to do with poor access to a dentist, having to do with poor access to universal preventive precautions. Every night my 2 children get fluoride tablets. Now, I'm a parent who does that. My wife does that. What if the child doesn't have access to that sort of fluoridation? What if their school doesn't apply to them, give them tablets, or apply it topically for them on a consistent and on a more consistent and standardized basis? Then that gets them off the grid, which means they're much more risk of lots of diseases, including oral health problems. So what's the solution? Effectively, here's how fluoride works. Fluoride, when you look at the Center for Disease Control, when you look at the American Academy of Pediatrics, American Academy of Pediatric Dentistry, the American Dental Association, I literally could spend my 10 minutes telling you the major organizations, the trusted bodies that support this, believe and state that this is a cornerstone to any comprehensive program, because it provides equitable access to a known public health benefit without regard for socioeconomics, school district, parents, etc. So it's a cornerstone, and all of the other things, health insurance, all the really expensive things, health insurance, school programs, access, transport, all of those things, those are part of a matrix that leads a country or a unit or a group to better health outcomes and oral health outcomes. But the cornerstone, universally across the organizations that we look to for recommendations, like the CDC, say this is the cornerstone. We've got 60 years of experience with this, starting with Grand Rapids, Michigan. So, who are the trusted endorsements? World Health Organization, American Academy of Pediatrics, American Medical Association, ADA, et cetera. And this brings me to an interesting point. I've been involved with this now for a couple months, and what I've seen is you probably heard at least 3 of those organizations named, and a few others in the previous presentation. It's fascinating how, to give statements of validity, these organizations are named while completely ignoring the recommendations of the organization. And I put to you, let me ask you this, you come to me and I'm your dentist, or you go to your pediatrician with your child, or you go, or you're looking at some issue with public health in the city you live in. Would you feel comfortable if me as your dentist ignored the American Dental Association recommendations, the Surgeon General, the Journal of Oral Maxillofacial Surgery if I'm doing an implant? If I just ignored it and took my own studies and dove down and showed you a slide that said, well, here's what I found in my studies, without regard for what the Department of Oral Maxillofacial Surgery or the Department of Public Health or my peers think, I've done my own studies as a medical professional. I'm going to do this implant this way. How would you feel about that? That's what you're being asked to do, is to ignore the recommendations of the organizations that have been looking at this for 60 years, including this year and last year, and trust people who've done their own research. Because people in Seattle or San Francisco or San Diego or Kansas City or Dallas, every city except for Wichita, Kansas, they don't really understand this. They're fooled, they're blind to what's really happening, they're putting their population at risk. That's what, when you put it into context, that's what you're hearing. Ignore the large advisory bodies, ignore other cities and their experience, and be afraid. We don't have to imagine a world where bad things happen. We have a world right here where kids like you just saw are going to the hospital for their disease. We have a world where 7% of our 0 to 5-year-olds at Care Oregon are getting their care in the hospital. We know that. We have 60 years of experience with fluoridation, and we have no evidence to show that it elevates arsenic in the public drinking water, or that thyroid problems are more prevalent from a rate or prevalence standpoint in fluoridated areas. It's conjecture. It's unsubstantiated, and it's designed to make you fear this. So, this is the Dean of Harvard, and I'm not comfortable ignoring the Dean of Harvard Medical and Dental School. The reason that they said these things is because the IQ study that came out from the Harvard researchers has been used and abused without showing you details so much that the deans felt compelled to come out and say, we support this. And then you hear people that oppose fluoride criticizing the dean, saying that they have some financial, Harvard, I don't know what their endowments, what, $2 billion? What are they making off of this? This is insanity. They believe it because they believe in science, and they believe in consensus and research. For every $1 invested in community water fluoridation, 38 in dental treatment costs. CDC says that. I'm not exactly sure what interest the CDC would have in saying that to you, other than they're interested in actually having a healthier community. All the programs, virtually all the programs that are part of that complex matrix that actually improve oral health, I'm involved with in our community. And I can tell you, I don't ignore the CDC's recommendations on one issue and then accept them on the other. They're very comprehensive and they're competent. So you've heard what they'll tell you. It's a toxin. It's going to hurt all these body systems. It doesn't exist naturally. That it's a product of the fertilizer industry, and there's some collusion between industry and healthcare. And I can tell you that is just patently false. And fluorosis, we can talk about, I'm running out of time here, but we can talk about fluorosis in Q&A. I see fluorosis in my practice. Very, very minimal mild fluorosis is very hard to see, and most of the time it's microscopic. Sometimes you see it, it's at the top of the teeth, but it makes the teeth harder. Very mild fluorosis has no negative health effect, but it makes the teeth harder. Okay? And the CDC would not look at the public and say, this harms you, yet I'm going to recommend it. That's just not the way they work. And so bear in mind, when they talk about 41% fluorosis, it's in the same document that they recommend that you fluoridate the water at optimal levels. Yeah, sure, that's right. I thought it was a 20-minute presentation. I did. That's why I was shocked when you said.
So both Kellie and Mike are going to come up here.
Yeah.
Do you mind shutting? And if for your questions, if it's clearly for one person or the other, just let them know. If it's a question that you want both people to address, I'm going to have my little timer and give each person 2 minutes to answer, if that is okay.
Sure.
If you want to answer first and you want to answer second, if it's for both, you can do whatever works. And you can also hold or pin, whatever's easiest, and yours is good.
I'm in place.
So questions? And thank you for presenting.
So my question is for Mike. In my research, I found like 42 studies that look at water fluoridation and intelligence. And 36 of those show a correlation between water fluoridation and reduced IQs. And I believe 26 of those are what were studied in the National Institute of Health study that was set up here. Has the ADA done like any studies in terms of intelligence and fluoridation? And you know, is it better for kids if there is, you know, any central nervous system effects from fluoride to, you know, rob them of their cognitive abilities in, you know, defense of their teeth, I guess?
Well, first of all, what you need
Repeat the question.
that's a long one, yeah. Effectively, he said the research that he had done showed 26 studies where fluoride had reduced IQ. 36 out of 42 have shown a correlation between reduced IQ and water fluoridation. And has the ADA done any studies like on IQ and fluoridation? Well, first of all, I'm not aware of a research study that shows that community water fluoridation of a municipal supply reduces IQ. I've not seen that. I've seen studies where they take naturally occurring fluoridated areas, like the particular one you're talking about, I think, is a large-scale review, and a lot of it was done in China, correct? But these were really high levels. In some parts, 10 parts per million versus 0.7 parts per million. And they saw some effects on IQ at that concentrated level. What I would say to you is, I mean, if my children, you know, got a bottle of vitamin C and started swallowing it like crazy, you know, it could have really deleterious effects. I am not aware of any study that demonstrates that a community water supply that fluoridates at the optimal level reduces IQ. The only thing I can say over the aggregate is that we've been fluoridating for 60 years, and the IQ of the American public, generally speaking, and in fluoridated areas, has been going up. Now, that's a simplification because it's a complicated thing. But, you know, and it's not like I just blindly follow this. I call the neurology department OHSU. I mean, some of the other issues they talked about, I called the allergy department and said, what's going on here? Tell me, is there something? And the neurologist at OHSU said there's no relationship between optimal water fluoridation and lowered IQ. If you have that, please send it on to me, because I'm not aware. I'm aware of a lot of studies that look at really high concentrations in China and in some other areas where there's groundwater, but not of. So, I mean, I don't know what research you're doing and where you're doing. All I can tell you is that Regina Benjamin, the Surgeon General of the United States, just endorsed fluoridating the water, and I have a hard time believing she would turn her back on science that demonstrates a real harm to the American public.
So
can I make a recommendation, if it's okay?
Sure.
Just because there's a lot to cover, and we've done a lot of these. 2 quick points. If we can time it, it might help you guys get other questions
help
in.
me too. So.
And I'd like to reply to that. And also let you guys know, go to Multnomah County Dem's site. There's a debate that Mike and I did with other colleagues. You can see more information, or the Willamette Week endorsement, and there's another debate. So some of these questions might be addressed there. Right. But in reply to this, the China-Harvard IQ thing, what I will say, it's a meta-analysis, and I bet that this group knows what a meta-analysis is. It showed a correlational relationship between different communities that had some naturally occurring fluoridation, some as high as 12 parts per million, one area that was looked at as low as 0.8. And what the author of that study showed through Harvard, not the dean, but the author, is that it's relevant to Portland. You can go to his blog site and see his comments and see that he finds concern for water fluoridation policy.
Just my last question, you were saying that I should go and do some more research. Like, if you know of any studies done by the ADA on it,
first of all, the ADA, the ADA doesn't do studies. For instance, the ADA put together panels of university professors and scientists for other large organizations, and they do meta-analysis and take their studies. The ADA is an advocacy body that brings, now there's a two medical and ADA, there are two sides to that. One is their political, which many times I don't agree with, which has to do with reimbursement fees and so on and so forth, and I'm not even a member right now because of some of that. The science, they pulled together some of the best folks on earth to do the science. I can tell you, I just this morning had coffee with the past executive director of the International Association of Dental Research, and he told me, the ADA's science portion is top notch. Political, so they're not to be conflated, but they don't do studies.
So I have a question. One thing I've not heard at all, and I can't say I've been paying most attention, is people aren't the only people that use the water supply. Is my plants, my very tiny dog. What's the effect on fluoride to those things?
Can I start with that and then you can finish?
Yeah, go ahead.
So a couple thoughts. I mean, it's been well documented. 90 to 95% of fluoridation chemicals will go downstream. Portland Water Bureau has been clear, fluosilicic acid, 1.1 million pounds annually a year. Now what you're here is no big deal in the salmon migration. The ocean has more fluoride. Our rivers can dilute it. 0.2 parts per million of the concentration is shown to hurt salmon migration. They're arguing about whether the Columbia River and Willamette can dilute this to a point where it won't affect fish. The point is, our rivers are already degraded. Do we want to knowingly add more arsenic and lead and other heavy metals to our ecosystem when 90 to 95% of it goes downstream? In addition, filters like normal filters, multi-pure, Britannia, don't take out fluoridation, only reverse osmosis. They're very expensive, $500 to $800, very small ion. You know, think about periodic table, halogen, small ion fluorine. The chemical itself can't be removed very easily, and those systems are highly inefficient. A lot of the water goes into our sewage system. Our rates on water and sewage are already sky high. Just this week, the mayor has to back out of his agreement to not increase water rates. And if you look at the ballot measure on this, it's not a done deal in terms of the bill. We don't know the full operation cost. The plant could be up to $7.6 million. 40% of our water users might not even be paying for it because of their contracts in other districts, and 90% of it's going downstream.
I don't know. Honestly, I can't go through all I can tell you is that for 60 years we've been fluoridating water in Little Rock, Arkansas, New Haven, Connecticut, and Kansas City are places I've lived, and I've had pets that lived up to 20 years in those areas. But that's not research, that's my anecdote. I would just put it to you, if you're thinking about all the cities, besides Wichita, all the large cities in the United States besides Wichita, for up to 60 years have been fluoridating their water. And I just simply would ask you to examine whether or not there are rates of things they're talking about, or with pet outcomes with veterinary bills or whatever it may be in those communities.
There's a couple vets in here that have endorsed our campaign also.
We listened to a presentation a week or two ago, somebody from the National Forest saying if they're going to build a road or do anything in the National Forest, they have to have years and years of impact studies and figure out what's going to go on in that specific area due to the change. First part of the question, has any sort of long-term impact study been done for this related to the Portland area in general? And also, just because we know that that it's safe in certain locations, how do we know that it's going to be safe here for the Portland ecosystem?
I can't answer that for you. I can't. But I would like to say that there is a larger context here that I'm interested in. A woman with poor oral health outcomes is at high risk of preterm birth. Her children are at high risk of early childhood decay. One of the number one reasons kids miss school in certain areas is because of tooth decay. This is not about teeth specifically. We know that this does have a positive impact on teeth and oral health. But there's a much larger issue that we don't talk about, and it frustrates me as a public health dentist. And when this is all over, I suspect, I doubt that many of the people that I'm surrounded by will still be going to the clinic and seeing these patients and advocating on behalf of this and doing all this. And I see what they go through. We were talking about foster parents earlier. I have 2 or 3 foster families I'm seeing right now, and the mothers cry every time they bring them in because they have almost impossible time finding a place that'll see a 3-year-old and a 12-year-old and her, and a 6-year-old and a 7-year-old. Now that's not just about teeth. That's a profound thing. She has pediatricians that'll do it. She has ophthalmologists that'll do it. But finding dental access, and then the kids have broken down teeth because many times they've been off the grid. And if they don't have that primary preventive sort of structure there that decreases their chance of having poor outcomes, they're at higher risk of disease. So no, I can't answer your question about the environmental impacts, and I'm not dodging it. What I'm saying is there's a much larger context than just teeth versus the other things we think about. It really has an impact on people's lives.
Before we jump into that, may I add on to that? This is about other things besides teeth. There's individuals with thyroid disease, diabetes, kidney disease, infant formula. It's not just about teeth. And even the effectiveness data that we have on population studies show it isn't helping our most vulnerable kids. He had decay up there, not untreated dental decay in Seattle. That's about access. And we need to look at the new data that came out.
That's not true.
So according to Oregon Health comments, it is.
It's partly
and the last
about it.
thing
It's
I'll
partly
say,
about it.
excuse me, I'm not finished, thank you. The last thing I'll say in regards to your comment, there's never been a large long-term impact study. In fact, the National Academy of Sciences review, Kathleen Northeastern has asked for that, and it hasn't been done. And in addition, there's never been a randomized controlled trial. Mike will say we can't do that. That's the gold standard of medicine, folks. If we're going to be adding something to our water system and we've never done an RCT, we need to be asking why.
You couldn't get it through an IRB because it's been endorsed by so many scientific panels and bodies. An IRB would not allow you to withhold something from half of the population to do a randomized control. They would consider it in violation of the Geneva Conventions
We could do
and
it in
human
Europe.
research. So I can tell you right now. Yeah.
Do you both time for a couple more
Yeah,
questions?
sure, I'm ready.
Do you have information?
Yeah.
So inequality's been sort of central to this whole issue. So are you saying that there hasn't been any study that controls for access to dental care, for brushing habits, for diet, and also for income?
I'm having a little trouble making. Well, we know that health disparities, negative health outcomes, oral health being one of the worst, hit hard in low-income populations. Okay, there's a lot of data to support that. We also know that low-income populations have less likelihood of having the whole comprehensive access to everything from primary prevention, which would be community water fluoridation, up to having a dentist that can fix a tooth that's broken down. So, but I'm not exactly sure the details of your question. We have a lot of data to support that those kids are much higher risk and they suffer much more, and that's why we support community water fluoridation.
Can I comment to that? If you look at Vancouver, that had been fluoridating for decades, 30-some years, their rampant untreated dental decay was very high, and in 2005, they had to create new initiatives to target the most vulnerable population. And when they did, it's called an ABCD program, their rampant untreated dental decay went down 50% in 5 years. We're often compared to Vancouver. We have started similar programs that Mike also endorses, like First Tooth here in Oregon, to allow early targeted intervention. That example that he gave of that 24-month-year-old, the data shows, and I just read something recently, and even though dental organizations agree, that that sort of decay doesn't get prevented in those early kids by water fluoridation. It's access, early detection, and care in clinics, and the baby bottle disease. It's a difficult thing to talk about, but Vancouver is a great example of low income that hasn't helped with fluoridation.
So I have a quick question. If
Sure.
we implemented fluoridation, how long would it take to see a positive effect in your business? And moreover, what's the flip side of the coin? If we haven't been fluoridating, how does that exacerbate your position?
Well, fluoridation as a primary preventive method would take years. So we do it next year, and then we would see 2, 3, 4 years. We would start seeing, different epidemiological numbers. So it wouldn't be an immediate impact, but it would be an impact over time.
Can we talk about what age groups are affected by this, and also what percentage of the Portland population would actually benefit from fluoridation?
Well, according to the CDC, according to the American Academy of Pediatrics, according to, I could go on, the Institute of Medicine, the Surgeon General's office, there's an aggregate benefit across the entire population. Now, if you look at people with insurance, they go to the dentist every 6 months, those people are not going to have untreated decay, they're going to get it treated. Those people are, because of income level and because of basically education level and hygiene, are going to be at low risk for disease, even if they don't have community water fluoridation. I think that there's an aggregate benefit across the population, but it disproportionately benefits children and adults who are low income and who don't have access to dental insurance. And let's be clear, as someone who sees patients and takes all insurances, access and insurance are two different things. Two different things. You drive by 5 dentists on your way to work, and if you all have healthcare benefits, I guarantee you they want your business. They won't even be taking the patients of the Oregon Health Plan population I see. I can guarantee that.
Can I comment to that? Because Willamette Week asked this very question last week when we were there. Why didn't you mention that to them as a possible reason that dentists don't necessarily, that do support water fluoridation? It's also, you mentioned that the ADA is political. One of the things that they're lobbying against is dental therapists. And dental therapists is a cost-effective way to have access to our kids. This was reported in the Portland Tribune. I know Mike has some disagreement about it. There's a pilot study in Oregon, and it's been working in Alaska where there's rampant untreated dental decay and low income, in Minnesota. So we're in agreement that access is important, and that's really what we should be talking about here. When we're looking at the data showing that in non-fluoridated Portland, we're doing better than national averages according to the Department of Human Health Services, and we've met 2020 oral health goals. Why are we talking about putting more lead and more arsenic and more metals in our water when there's a reasonable basis of concern and other alternatives are working? And frankly, Healthy Kids, Healthy Oregon, the initiative, any low-income kid who wants health care can get it. Obama's care is including oral health for low income, so there's more money coming into our state. No one is talking about this.
The Philomath water study we just conducted, they've been fluoridating their water now. It showed no elevated levels of the things she just said.
No, what I...
they just did their own sample, I understand, and I'm not sure where they got it from.
I can comment to that. It was in the press yesterday. They took a sample from Philomath of fluorosilicic acid, the chemical compound of choice for our water. That's what they use in 90% of our water programs. And William Hersey, an EPA scientist, actually did an analysis through a lab. There were 2 lab analyses done, and they showed higher levels of arsenic. They showed aluminum and chromium. And what he did is an EPA analysis of the risk of bladder and kidney cancer related to an EPA analysis on arsenic alone. So undetectable does not mean not present.
He did it on his own?
No, he did the analysis with the data. It's in the news. You guys can get copies of all this.
Okay.
I'm going to interrupt briefly. I don't want to keep everyone too long. We've gone a little bit over. We've got our timer over here. If you all want to make 1 minute sort of final statements, if that's all right, then we'll end.
Well, you can go ahead if you want to. Or...
No, go ahead. I'm fine.
No, I just say I support this because I'm a community health dentist and I see the patients firsthand. I see the negative outcomes. I see the impact it has on families. I support this because I teach courses and I do a fluoride lecture and I dig through the latest science every year, usually looking at CDC panels, usually looking at ADA panels, usually looking at Academy of Pediatric panels. And I support it because I'm a member of the community and I believe in science and I believe in the scientific process. And I do not support policy making by anecdote. I think when you have large organized bodies, although yes, they've gotten it wrong in the past on some things for the most part. I have friends from all over the world that are scientists and they say that the CDC is one of the most scrutinizing, hardest hitting evidence-based bodies on earth. And when they say something is true and I look at the hundreds and hundreds of scientists and thousands of papers that they look at every couple of years, I trust it. I trust it. And I believe this works. That's why I support it.
Thanks for having us here today. And as Mike has said, the CDC also says the benefit's topical. So I believe that we shouldn't be knowingly swallowing more metals in our kids' water, in our own bodies, in our community, when there's a reasonable basis of concern and the emergent science is showing that. You know, we're not cherry picking, we're looking at, again, funded science. You can go online, you can go to cleanwaterportland.org, you can look for these references, you can go to Fluoride Action Alert. I look at data. I got on board because the effectiveness data, true data, is not there. I believe there's potential risk to our community, I believe there's potential downstream risk, and I believe we have better alternatives that are working and that we need to be talking outside of sound bites. I encourage you to get involved, go out to Clean Water Portland, hit the streets this weekend, get yard signs, and please, if you have the ability and feel passionate, donate. $30 can go a long way in getting our message out.
Thank you.